Hello viewers, I'm Dr. Amit Reddy. I'm an orthopedic surgeon at Continental Hospital. I specifically deal in treating bone and joint related problems. Today we'll be discussing about a specific topic, that is knee arthritis and knee replacement. Now, where the joint is completely damaged, then knee replacement is the most ideal choice. Until then, there are a lot of treatments available which can slow down the process of damage or prevent it to a certain extent. But where it is completely damaged, knee replacement is the proven long-term solution for it, which can provide a life of about, in the various studies which with various implants, and we tend to see them anywhere lasting between 10 to 25 years. Now, what are the type of implants available? So most of these implants are made up of cobalt chromium alloy, and they have a coating of it, especially oxynium and a couple of other things, which prolong the life of the implant. And we can expect a longer duration and longer life of these implants post-surgery. Coming to the rehabilitation part, usually day 1 is when we do the surgery, and day 2 is when we start walking around and certain physiotherapy exercises. By day 3 or day 4, when you're comfortable walking around, moving around, that's when we plan and discharge home. And we call you back after about a week for removing these sutures. Post-surgery, there will be some specific exercises. For someone who's well motivated, they can do it on their own. But if not, they can always take help of a physiotherapist. And in about 2 weeks to 2 to 3 weeks, they become comfortable, and when they can perform their all regular day-to-day activities. You may expect some amount of discomfort while the progression from surgery to post-surgery occurs, but it's in a decreasing trend wherein the pain and discomfort starts improving. Thank you.